Hi, I'm Dr. Jason Wagner, and thanks for joining us for another Whiteboard Wednesday. So here at Sarasota Vascular Specialists, we see a lot of patients with leg ulcers. And an ulceration is a breakdown in the skin. Could you see a superficial breakdown at the skin, in the lower leg above the ankle, or it could be a deeper wound where actually bone or muscle are exposed. And if someone has really bad, long-standing leg swelling, this could be a sign that they have what's called a venous ulceration. What that means is that there's been so much pressure built up from veins not doing their job or not letting blood get out of the leg that the leg has swollen to the point where the skin itself is starting to break down and can't repair itself. Often these come on spontaneously or as a result of a small, tiny little injury, a nick, a scrape, you bonk it on the side of a bedpost and it's just failing to heal, and then the wound keeps getting bigger and bigger and bigger, or you get a small nick and then you have a little bit of clear fluid that's leaking out of your swollen leg, and then that gets infected and you have an infected ulceration. This is a normal leg on the right that's just showing blood flow getting out without a problem and the leg's nice and skinny. The left leg, for example, you see all this outward and downward pressure and all this outward swelling. That's because blood flow is not just only not getting out of the leg, but it's actually settling back down the opposite direction. Well, what happens with that is the deep veins and the superficial veins, as they're letting blood go down the wrong way, it's starting to pressurize all these little smaller veins. Ideally, all the smaller veins should be feeding into the bigger veins and it should be feeding out of the leg. But if the pressure or the flow is going backwards, now the flow is being pressurized into these smaller veins. Well, as veins get smaller and smaller, down into the tissues and the skin, the walls themselves get really thin. And what happens with that is the fluid of the blood, the plasma, the juice, if you will, starts getting pushed out through the vein walls. And then you have this extracellular or extravascular fluid, we call it third space fluid, that's between the layers of the muscle, the layers of the skin. If you think of, kind of like water balloons, you're gonna have most of this happening at the most dependent areas. So if you take a water balloon and you hold it up by the knot, it's gonna be skinny at the top and wide at the bottom. Well, the same thing starts to happen in our legs because all that fluid that's in your leg starts to settle down towards the ankle. So you're gonna have the highest area of pressure down here. So as you can see here, if you have pressure, that fluid that's kind of waterlogged and stuck down there and it's sitting dependent because you're sitting with your leg down or having your leg hanging down, that pressure is going to go towards the wall. And if you multiply that, there's a thing called the law of Laplace, that's going to cause increased tension on the wall. That increased tension, if you think of it, just like stretching. So if you've ever seen one of those high-speed videos of someone popping a water balloon, it's not that they poke the water balloon and all of the water goes straight out to that tiny hole. What actually happens is they poke the water balloon and then the entire water balloon snaps back, leaving a little kind of pocket of water right there in the middle before it splashes down to the ground. And so when your skin is under so much tension like that, it does a couple things. The first is there are these little nerve endings that are in our skin that are under constant stretch. So you have this kind of chronic heaviness, burning, aching, maybe itching feeling. Then as the tension's there, if you had a nick or a cut and it's not healing, that's because it's under kind of constant stretch. So it's kind of like someone's trying to build a bridge across like a fault line or across a river and the shores keep getting farther apart. So if you're trying to build a bridge together but the ground keeps moving further apart, it's never really going to heal. You're never really going to be able to get that connection across. What we need to do is figure out whatever the cause is that's causing the leg to be swollen. So if it's bad acting vein valves from a vein you don't need and we can shut it down, so be it. If it's because of a blockage higher up in the veins, and we can open it up to decompress the outflow to make it easier to get the blood out of your leg so that it's not as waterlogged or swollen, we can do that. But the most important thing we need to do is get you into some form of compression because, just like I was saying, where everything's being pulled apart with that wall tension, if we can put you in a compression stocking or some sort of compression bandage, we can wrap it from the outside, give it a hug and hold it closer together to take that tension off the wall of the skin. It's not a permanent solution, but it will help allow the body to be in a better position to heal. The other thing we'll do as part of that is going to be appropriate wound care if there's an ulceration or a problem. If there's an infection, we'll give you antibiotics. But the biggest thing is take the tension off the wall, let the body start to heal. Some people will complain that they can't tolerate compression dressings because whenever they put them on, their legs start to burn and ache like crazy. And that's understandable. Remember those nerve endings I just mentioned that they're under constant stretch? Well, if you take that tension off the wall, they start kind of coming back together and acting more normal. They're waking back up and they're going to be firing off like crazy. So you might have 6, 12, 18 hours of pretty significant discomfort until things start to kind of feel and go back to normal. You kind of have to get through that discomfort before things can get better. One additional thing we'll definitely make sure we do before we put you in compression and before we do anything else to figure out what your wound healing potential is we need to check and make sure that you have good blood flow on the artery side, the oxygenated blood that has good nutrients. You need to make sure that you have enough of that getting down to your leg as well. So if you don't have an easily palpable pulse in your foot when we're examining you, then we'll check and make sure that there aren't any blockages in the arteries that might also be contributing to your ulceration or your wound. In summary, when it comes to a leg ulcer, and we think it's a venous ulcer, things we worry about are swelling, skin stretch, bad acting veins, and being the vein valves or an outflow blockage. And the primary ways we're going to manage this is first with a compression dressing, and then good wound care, and then also checking to see what kind of things we can intervene on or fix to get rid of the problem, help your legs heal up faster, and hopefully prevent an ulcer from forming again. If you have any comments or questions, feel free to leave a comment below. I'm Dr. Jason Wagner with Sarasota Vascular Specialists, and this is another Whiteboard Wednesday. Thank you.